My area of focus is perinatal mood and anxiety disorders, which are a set of disorders that occur in women who are pregnant or postpartum and consist of a spectrum of behavioral health issues from anxiety through depression through psychosis. Perinatal mood and anxiety disorders have been around, I believe, since women started having babies, but I think some of the cultural changes that have occurred in how pregnant and postpartum women are treated in our culture now has perhaps heightened some of the expression of it. In some other cultures, women are more nurtured and protected for periods of time after giving birth, with lots of aunties or other people who come and help to take care of the baby and maybe alleviate some of that vulnerability, but it has been around forever. There are some very famous cases in the literature and in the news that you would have heard about 10, 20 years ago, where women have actually committed infanticide in a postpartum psychosis. But that's relatively rare. That only occurs in 1 to 2 out of 1,000 women, whereas as the larger disorder, perinatal mood or anxiety disorders, occurs in nearly 1 in 5. We have a spectrum that ranges from a relatively mild anxiety or low mood that persists and causes some dysfunction, through a series of symptoms that might include more ruminative, obsessive, compulsive thoughts, which occurs in 3 to 5% of women. And that disorder, women may have these intrusive, unwelcome thoughts of something happening to the baby, perhaps at their own hands. But those women, very different from the even more rare postpartum psychosis, the women with obsessive compulsive thoughts would rarely, if ever, hurt their children. The thoughts are so abhorrent to them, thoughts of perhaps drowning their baby, that they avoid bathing the baby and keep themselves from any risk whatsoever. That is in contrast to the postpartum psychotic woman who has what we call ego-syntonic belief, which is matching her thoughts of hurting the baby with her belief set, often believing things like the baby's possessed or something is really wrong with the baby, and if they kill the baby, that they would then be actually helping the baby. So very different. So the spectrum goes from a mild anxiety or a mood disorder that is really treatable, through the OCD or obsessive compulsive disorder, which is also very treatable, through to psychosis, which is very treatable but is a concern. That's a mental health emergency. It needs to be addressed immediately because there is a risk of infanticide at that level of disorder. That's an interesting question, because the DSM-5 defines it only in the first 4 weeks after giving birth, but in fact we know from cases that it lasts the entire first year postpartum. And also, more interestingly, it used to be called postpartum depression only, but we now recognize that many of the more severe illnesses actually start during pregnancy and may continue or have onset in the postpartum first year. Perinatal mood and anxiety disorders are recognized by a constellation of symptoms that include the basic symptoms that meet criteria for depression: low mood or feeling depressed, or anhedonic, which means an inability to enjoy things, in combination with a number of other what we call vegetative signs, including sleep disturbance, appetite disturbance, some feelings of hopelessness perhaps, and in fact even some potential thoughts of suicide. The anxiety disorders, which are another constellation of the perinatal mood and anxiety disorders, are those symptoms that we may recognize as feeling on edge or upset or nervous, but to a greater degree than just I'm nervous about taking a test or I'm nervous about company that's coming or something like that. It's a persistent feeling of unease or dis-ease that is interfering with your ability to function. It's not clear that it's a causal association between the rapidly changing hormone levels that occur during pregnancy and postpartum, but they certainly seem to be a trigger in vulnerable women. And some of the risk factors include single or unsupported in some way women with a previous history of depression or anxiety, women who have reacted to stressful situations with a depressive kind of tone, women who are smokers, teenagers are somewhat more at risk, women who have had a previous perinatal mood or anxiety disorder or have a family history. And each of those are additive cumulative risk factors, but the really important fact is that it can really happen to anyone. And we've seen women, famous women in the press who have come out talking about their own perinatal mood disorder, including Brooke Shields, most famously with her interaction with Tom Cruise. She actually wrote a book, Down Came the Rain, that talks about her experience. But Halle Berry has talked about it, Reese Witherspoon has talked about it. A number of women who you would think have all the resources in the world at their disposal, and yet it can happen to anyone. And that's a very important message for women, for people.